Okay, we're looking at Nancy Pelosi complaining about removing Obamacare, or begging that we don't remove it. Now she started out with the usual where we're gonna make America sick again and all this bullshit, but now she's bringing a nurse on to tell anecdotal stories to try and convince us we need this crap.
Aaron Palmer of Milwaukee, Wisconsin. Now my pleasure to yield to Vicki Gonzalez from Miami, Florida. And welcome all of our nurses who have joined us today. Thank you.
Thank you, and good morning, Speaker Pelosi.
Oh, also, I should point out there are 12 women and 1 man in the background. I assume they're all nurses. Hashtag more male nurses.
My name is Vicki Gonzalez, and I am a wound ostomy nurse at Jackson Memorial Hospital, Florida's largest public hospital. My heart is overjoyed when our patients get the care they need. Not too long ago, Jackson Memorial's emergency room was consistently flooded with individuals who lacked health care coverage and relied on emergency medicine for primary care. We can't turn them away, but emergency medicine costs 5 times more than a visit to the doctor's office. Far too often, uninsured
Unless you're an illegal and you just refuse to give them any kind of identification or anything where they could find you, in which case for you it's free. Now, come on, we've all done the emergency room visit thing because we had to. Let's not remove that as an option. Now, what would the alternative be? You think of how it is now with this fucking Affordable Care Act. They give us the cheapest medicines. The doctors don't even get paid enough to justify being doctors, Ever since the Affordable Care Act, the most doctoring I've got was a man walking into the room with a laptop and using Google. Now, they're not even using their Dr. Brains anymore. They're using Google right in front of you. It's Google. If we're going to start getting Google healthcare, why are we even going to a doctor? Why? Anyway, let's continue this.
individuals can't afford out-of-pocket charges that can easily exceed a month's rent.
Yeah, but what did the Affordable Care Act do? It took all the good, more expensive medications completely off the list. Doctors are not encouraged to give you a nice, fancy, new, great medication. They're encouraged to give you the cheapest crap possible. Now, I don't know about you, but I prefer the expensive stuff. When I can afford it, I prefer the expensive shit. Okay, I'd like it to be at least an option. As it is, it's not an option.
But with more patients covered and more of a safety net, my hospital can invest patient care dollars wisely. More patients have access to care regardless of pre-existing conditions.
Which is to say, this woman knows nothing about economics. If insurance companies are going to be forced to insure regardless of a pre-existing condition, then everybody's insurance is going to go up. And even though Obama appropriated some funds and is using it to cut the difference between the cheaper plans and the better plans, that's still coming out of our pockets someplace. Why do we have to have the silver plans artificially raised to the level of gold plan? Why? If you wanted to buy the cheaper plan, you should have been allowed to do so. so many people can't afford insurance under this system, and they've got to just pay the fee. Now, I don't see why people see this as a solution. It's stupid. First off, if you're going to utilize insurance at all, you've got to pay the insurance coders who work at the doctor's office, and you've got to pay all the insurance people. I mean, you're adding like 100,000 fucking extra employees to the mix. Why would you do that? Why would you do? They give you a cut rate if you don't use insurance. If they know that you don't have insurance, the bill collectors will cut you some slack. Because they know the only reason they charged all that much with the insurance is because of all the extra people they had to pay. They know the services don't cost that much. They know the hospitals and the doctor's offices own that fucking equipment. I mean, and not a lot of that crap is, throwaway shit. Anyway, let's continue.
If Congress forges ahead and takes health care away from millions of Floridians, people throughout South Florida will be forced to rely on our emergency room services once again, and we'll go back to being in the red. Miami's robust entrepreneur community may not be able to afford whatever Republicans in Congress propose as an alternative.
Why propose an alternative? This is one of the things where the free market does work. I mean, in trade with China or whatever, it's debatable because they're smarter than us, and have you ever looked at the graphs of their money's value? It's clearly manipulated. I mean, it's not a natural looking graph. It is manipulated. Now, what have we got against the free market? What have we got against getting what you pay for? What the hell is the problem with that? The hell is the problem with that? I don't want to have a doctor using Google when I go into the doctor's office. The doctor spent years and years in medical school, then he uses Google. Come on, I want an effective quality service by an effective quality service professional, not a healthcare provider. Because, come on, it's not as though they actually provide healthcare. You go in there when you need to. You provide your healthcare. You make sure you eat and sleep right and do all that crap. They're not healthcare providers. They're a service professional. They're like an electrician or something. Now, with an electrician, they may fix your junk when it comes time to fix it, but it's up to you not to spill water on your wires or plug in things with shorts in them or whatever. That's up to you. They don't provide for your electrical health. So doctors are not healthcare providers. They're just providing you a service of their knowledge. And they're not even doing that anymore because now it's Google.
Of course, our taxpayers will shoulder the burden too. To paint a picture of how critical affordable care is to Miami-Dade community.
Affordable Care Act is what's making us shoulder these fucking burdens.
Just this month, a Miami Herald story showed that 3 congressional districts in South Florida have the highest number of people who purchase care on the health exchange in the nation. Clearly, patients need that care. We need Congress to put a real plan in place that ensures hospitals and healthcare professionals can serve our patients and our communities with the quality of care they need and deserve, not less.
So, they're basically saying we deserve jack shit. The Affordable Care Act causes us to get cheaper quality medicines. Come on. Come on, before the Affordable Care Act, I could have went in and said, Doc, give me some Rimron. I weigh 120 pounds soaking wet, and that pill makes me hungry. And they would have given it to me, even though it was off-label use. They would have given it. Now, they're just going to Google pill for weight gain, and they'll give me whichever one comes up to the top. I mean, hell, with this Affordable Care Act, I couldn't even get them to test me for STDs. I had to find a new doctor because it embarrassed the other one too much. I mean, when you get berated and you know, just, well, berated because you're going in there to get fucking some crotch rot checked out, and they pull this shit. It's just, come on, we have to pay our doctors enough for them to do their doctoring, to justify all their years of schooling. The cost-benefit analysis is very poor for doctors. They're not doing that great. They would prefer you don't use insurance, because most of that money doesn't make it to them if you do use insurance. Okay, they have a whole bunch more employees they have to pay if you utilize insurance. You know, just to figure out what insurance codes the bill should under, you know?
And now I'll introduce Michael Collins, registered nurse from Las Vegas.
Good morning. Pelosi. My name is Michael Collins. I'm a registered nurse at University Medical Center in Las Vegas, Nevada. University Medical Center is the only bone care center in the state of Nevada. It has the only level 1 trauma center in the state of Nevada. And
that's enough. You've got the point. You got the point. I'm calling this video Affordable Care Act naggery. Okay.